I'd like to introduce Ilan Geva, the CEO of the Ilan Geva in France. And he's a real expert in branding and marketing. And I have known him many years. He has visited South Korea many times. And many people in South Korea really like his presentations because he have dealt with very practical issues. And I'd like to introduce Ilan Geva. Yeah. Please.
Thank you very much. Thank you. Hello, everybody. Thank you for inviting me for this wonderful conference with some very, very good friends and experts in the field of medical travel. I am basically going to talk to you heart to heart and not with slides, because I believe that in this age of pandemic, in this age of not being able to travel, not being able to communicate and meet people and touch people, it's a very, very special time in our life. So when we talk about marketing in the age of COVID-19, I'm already challenging everybody to just look at us now. This is not normal. What we are doing now is not normal procedure. This is not the way that human beings are communicating with each other. So if I have to ask, is marketing different today than it was last year in 2019? I would say definitely yes. And marketing will forever change after we finish with this pandemic. Why? Number one, there is fear. There is a lot of fear out there. Consumers are not as open as they used to be to all the marketing offers that they get because their preferences have changed. The second reason is that there are fundamental changes in market conditions, like affordability, like access, like choices. Everything is changing around us. So with it, marketing will have to change. We also start to see that because of what's happening, many are over-promising and under-delivering. Okay, so we have to really be careful with what's happening around us. Technology created something that is very unique to this situation. Because of technology, consumer expectations are going up all the time. Just think about telemedicine, just think about all the other things that are provided to us. Customers are now expecting to get an answer immediately, just like they buy on Amazon. You go to Amazon, you buy, you get it tomorrow. Well, consumer expectations are not different when it comes to medicine and medical services. So think about it. And there is finally another reason for the major changes is that there is an overload of messages on all platforms, on email, social media, whatever, Facebook. It is exploding because human beings don't have any other way to interact. So before you begin to market anything, before you start any marketing effort, I want you to really be honest with yourself. First of all, are you still thinking in pre-COVID terms? Because if you do think in pre-COVID terms, you may have problems to adjust to the new reality. Now, did you change anything in your business model? Because, I mean, just look around you. There are so many companies that their basic model, the business model, has changed because of what's happening in the world. Are you offering what consumers really need and really want? And I'm always emphasizing the difference between need and want, specifically in the business of medical travel. Are you really better than your competition? And I'm talking about service, not medical, because we all know that it's very difficult for one doctor to say, I'm better than another doctor. And in many companies, it's even illegal for doctors to say, I am better. How do you judge a better doctor? It's a very difficult thing, but what you can be judged is by the level of your service. So customer service is something that you want to excel in before you market anything, because you can start marketing, and if you do not provide the appropriate service that matches what you tell people, you will fail. Now, I want you to think about a completely new concept. The concept of marketing yourself as a caregiver. Caregiver. That's a very important element in today's life, and it's important for people because people are looking for the human touch. They're looking for somebody to care about them. Can you say that you are a service that provides altruism, compassion, patience, and empathy? Those are incredibly important things that people are really, really craving to get this day. Will you market safety? Now, of course, everybody say, yeah, we market safety because we now clean the hospitals and we now make sure that everything is, sanitized and blah, blah, blah. No, I'm not talking about that. How do you market safety? Will you just talk about the hand sanitizers, the plexiglass screens and the safe distance? Or can you project more than just the pure technical things that are in your lobby or in your offices? And you need to project safety in everything you do. Now, will you market innovation? Innovation is, of course, a word that everybody's using. Everybody's trying to project themselves as innovative. How? Are your services, equipment, and staff, are they creative, imaginative, non-linear, and non-conformative compared to other? So I'm presenting to you possibilities to be innovative, not just by having the latest equipment from GE or Samsung. That's not what I'm talking about. I'm talking about the human side of being innovative in imagination, non-linear thinking, and stuff like that. Now, are you going to add all these elements of human innovation to your arsenal of marketing after COVID? Will you do webinars? Will you write blogs? Will you do what I'm doing now? Okay, in short, can you become an authority in what you do? Someone that patients could trust and they want to be with. And a website is not doing it. A website may attract people to connect with you, but once you create the human connection, you need to build trust. So I want you to think about the following. COVID took away a lot of humanity and empathy, and we are all hiding behind masks, and we're hiding behind computer screens, and the human touch must be avoided because that's what the ministries of health are telling us. Don't get in touch with anybody. So what are we going to do about that? Fear is in control now. How do you address the amygdala? The amygdala is the brain fear spot in every human being. There is this little thing in our brain that makes us fear. In your marketing materials, are you really thinking about the fear element? And think that the world is a very fragile environment right now. I want to give you a very interesting example which actually came from Korea. During the 2008 recession, Hyundai marketed their cars in the US by telling people this: right now, buy any new Hyundai, and if in the next year you lose your job, we will let you return the car. Now, of course, I'm not saying that medical institutions can do it. However, I want you to think along those lines. This is a very emotional, very personal, and very reassuring message. And I want you to take this message, the style, and think of it as an inspiration for your post-COVID marketing. In addition to your fantastic healthcare services, what else do you provide? Always think human. COVID-19 is causing a major behavioral change in our global society. Social media is actually increasing the global panic because you never know, there is so many fake news out there that tell you to take this medicine or that medicine or rumors about things. You really have to control that and make sure that you know everything about what you say and what you do. Always remember, what might be a good solution for your marketing efforts is not necessarily a global formula. You have to find your own voice for your own market, and please don't copy messages from other people in other markets because it may not apply to you. Now, we may survive the virus and learned a lot about digital solutions, but as appealing as it might be, something is missing and we need it. We are craving for a physical sense of belonging, desire for human connection at any price, everywhere, including in marketing materials. So please reevaluate your business offering, your relationship with the world, and with your priorities, because they may change in the future. Mahatma Gandhi said, "Be the change that you wish to see in the world." Can you do that? So far, the world around medical tourism is not showing much change. Just think about that. Airlines are just going broke, but they still treat customers badly. Hotels basically reduce their services using the excuse of being clean and keeping you safe. Insurance companies are actually worse than ever, and most companies reduced the level of customer service with one excuse or another. Now, that is really not good. Should you be one of those companies? After all, customer service is marketing. Think about it. This is a new concept. Customer service is marketing. In difficult times, your customers and patients will notice the difference you make and will remember it for a very, very long time. So make the difference. If you make the difference, it'll be your best marketing. During the hardest times of the pandemic, all marketers say, and I've seen many, many TV commercials that say, "Oh, we are with you, we think of you, we take care of you." This is really typical corporate language that basically means nothing. And all these companies that say that message they seem to be apologizing that they didn't take care of you before. So why suddenly they take care of you now? It doesn't make sense. Historically, we know that any marketer who neglected the authenticity of his brand was forgotten and eventually failed. And I have noticed that in almost all the recent webinars on what to do after COVID, no one talks about working on the internal brand. And I would recommend to all of you to start and think about auditing your brand. Make sure it is still relevant for your customers, and more importantly, relevant for the times that we are living now. Thank you very much.
Ilan, and I really enjoy your presentation as usual. And now the next speaker is Claudia Mika, and she is the CEO of Timos International company. And this company is quite famous, especially in Europe. And in South Korea, most of the Korean hospitals are not quite familiar with this Timos, but it might be a great opportunity for Timos to introduce their services to the. Okay, so I'd like to introduce Claudia Mika. Okay, please.
Thank you very much for the introduction. So I would like to share my screen now. So then, thank you very much for the invitation to speak at your event this time. I was asked, and it's a great pleasure to talk about being prepared for the new normal, accreditation as a reliable tool to assure patient and staff safety. So, and I gave it a subtitle, in other words, why hospital managers of accredited organizations sleep better than those of non-accredited organizations. So being prepared is the new normal, and this is what I would like to explain a bit during the next minutes. So we talk about SARS-CoV-2. So, and as the word says, SARS-CoV-2, there must have been a SARS-CoV-1. And some of you might remember that this was in 2002 and 2003, where we were the first time had experience with SARS-CoV-2, but most of us forget about it. But when we talk from the quality and accreditation perspective, we had some first experience with a virus kind of what we experience today. Of course, not that severe and not with these infection rates, but due to the similarity, we have some experience. And based on that, we already adjusted at that time our accreditation criteria. So what do we know from those days? We know that this virus, SARS-CoV-1 and also SARS-CoV-2 nowadays, is transmitted via droplets and aerosols. We know that it was and still is very stable, and we have a measurable activity of up to 72 hours on plastic and iron. This is what we know at this moment for SARS-CoV-2. So based on that, as I said, accreditation criteria were already adjusted at that time. So accredited organizations should be prepared somehow for this new virus. And the question was how to fill the gap. And in the following slides, I would like to explain you a bit how accredited hospitals may have been prepared already or might have been prepared better than non-accredited hospitals and clinics. And before I do that, I just want to give you, because I'm from Germany, just want to give you a short overview of what's going on here in Germany. So we have more than 80 million inhabitants. And since end of April, we have what we call the AHA rules, which means the translation into English, distance, hygiene, and face masks. So we have to wear face masks in the public, we have to follow the hand hygiene, and we have to keep distance of 1.5 meters. With this, we deal with this virus quite well, which means at this moment, we have a stable infection rate of around about 2,000 new infections per day, but we have a very low death rate because we track, we test, and we have a quite good overview of what's going on. So at this moment, nobody is safe, but we can say that we are dealing with it quite well here in Germany. So back to the topic, how does accreditation help now and in the future? So, and I would like to give you 3 examples from practical standards we use every day in our accreditation programs. The first is hand hygiene. And the second is infection control screening and monitoring. And then the third example will be emergency preparedness. To start with the first example, hand hygiene. So one of our standards, which is called infection control, hygiene and prevention, is hand hygiene, the process. So one of our standards says the implementation of the 5 moments of hand hygiene published by WHO is assured throughout the healthcare provider. And this is the 5 moments of hand hygiene which are listed here. So those organizations who go for accreditation must assure that this standard is fulfilled. And they must provide evidence. So they are already familiar with proper hand hygiene, and there was no need to learn it from the scratch again with this COVID-19 pandemic. The next standard is regular training on hand hygiene to caregivers, medical and nursing staff is ongoing and documented. So hand hygiene has to be done, practiced. It has to be trained on a regular basis, and this is documented. So people are familiar, the healthcare staff is familiar with hand hygiene. Next standard says measures, evaluation, assessment, and monitoring of correct hand hygiene are taken and corrective actions are implemented. So it's not only that you do hand hygiene, that you train hand hygiene, you also monitor, you observe your colleagues in an ongoing process if they follow the hand hygiene. And you help each other, you remind each other when you follow these standards. So this is the hand hygiene. The next example I would like to give is the infection control and screening. So we call it in our standards, and here is one example, guidelines and protocols for the admission and or treatment of potentially infectious, including international patients, are available and implemented on the organization's risk assessment. These guidelines and protocols include, where applicable, patients from other countries with different risks of being infectious, patients being transferred after long-term stay in another hospital from the ICU, home care, and other sources of infection. So this means here, there are guidelines and protocols, how to deal with infected patients. Of course, we could never name COVID-19 as one of the risks, but if the hospital has a risk assessment and a risk management in place, they just need to adjust this risk assessment by COVID-19 necessities, let's say. So, and guidelines and protocols are available and how to deal with those patients. So there is a kind of preparation already in place, or was in place, has been in place. An active infection control committee exists. The determination of interventions for infection control should be based on risk assessment and adequate planning by infection control experts. Measures taken should be regularly evaluated for their effectiveness to review further adjustment by the committee. So we demand, we want that an infection control committee is implemented. And this infection control committee is responsible for the infection prevention within the hospital and clinic. These are experts. They follow the everyday developments all over the world. So they also follow COVID-19. And respective measures are then taken based on the recommendation of the infection control committee. And this not only applies for COVID-19, but it applies to all infection control measures. Screening for and identification of multi-resistant pathogens is based on current international evidence. So this is what I just mentioned. The Infection Control Committee follows the international developments, and those measures and screening for an identification of are based on the knowledge and international state of the art. As the third and last example, I would like to give you the practical experience with emergency preparedness. So one of our standards says, based on the healthcare provider's risk assessment, and again, risk assessment, and as part of the healthcare provider's risk management, as well as in cooperation with the local authorities, possible emergencies and any kind of disaster are identified, classified, and respective procedures and instructions are in place. So there's a general framework of how to deal with emergencies and disasters. This must be available. And adding a pandemic situation like COVID-19 is then to fill a gap which was not existing before, but is existing now in this current situation. So those organizations who have an emergency preparedness and management plan may be better prepared for such a pandemic and how to deal with it than those who have nothing in place. So having given you the three examples, just to summarize, how does accreditation help? So hygiene and infection prevention standards are already implemented. And of course, there are more. I just gave you a few examples. So there are policies and procedures in place, how to deal with hand hygiene, how to deal with infection prevention. The staff is already trained. So there are compliance staff regarding hand hygiene. And it's very interesting that nowadays we don't need to motivate medical doctors anymore too much to follow also the hand hygiene regulations, which was or has been a problem all over the world for the last years. So now with COVID-19, we say that the compliance rate of medical doctors is very high due to the COVID-19 pandemic, which is great and which is a good development. There's a quality culture already implemented in those hospitals and clinics who follow accreditation standards. We have monitoring tools in place. So we measure, we document, we know what is going on. And for the second part, disaster management and preparedness plans, yes, they are already in place. So it's rather an adjustment now instead of an unsystematic reaction to the current situation. The responsibilities are clearly defined. We don't start from scratch how to deal with it. And there is a responsive committee or committees which are already there and help to deal with the situation. And many other points, of course, to be added here. So this is our own experience, but there was in May, already end of May, the colleagues from the Jordanian accreditation body, they did interviews with the accredited and non-accredited healthcare institutions in Jordan, and they found exactly the same. So we have similar experience like the Jordanian colleagues, and this was published on the ISCOR website by a white paper. So if you are interested in learning more, also from the colleagues from Jordan, then please feel free. You see here the reference to the ISCOR website where more information is available. So in the end, how does accreditation help? We have kind of preparation, and we are prepared for general pandemics or general disasters, not necessarily COVID-19. So what is needed is to fill the gap between the existing standards and the new situation. And this is why we did quite at an early stage a very careful research with CDC, WHO, and other reputable organizations. And to fill the COVID-19 gap in healthcare organizations, we prepared a document of new standards to fill the gap. And these standards are free of charge, available after registration on our website. So this is something where we wanted to contribute to the worldwide pandemic situation. And we are continuously updating the standards. So next week we will have version 3.0 already of the standards, because so much can be learned now day to day from all the partners worldwide. And this is then transferred to the standards document. If somebody is interested, there is a certificate of compliance we offer, but there's no need to go for it if you just want to learn from the standards and don't want or need a third-party confirmation of the implementation. So having said this, I would like to thank you very much for your attention. You see my contact details here, so if you have further questions, please feel free to contact me, and all the best for the event. Thank you very much again.
Thank you, Claudia. And I really appreciate your great effort to contribute to, in this battle against the pandemic. And now, the third speaker is Valorie Crooks, and she is a professor at Simon Fraser University in Canada. And she also has visited South Korea several times, and she has dealt with many diverse issues in medical tourism field. And she will talk more about the caregiver issues today. Okay, and I would like to introduce the Valorie Crooks.
Thank you for having me present at this forum. It's a real pleasure to be back. I'm a researcher who's been studying medical tourism for over a decade. And in my presentation today, I'm going to talk about a group of individuals who are strongly supporting the medical tourism industry, but that we often don't think about. And that is that I want to talk about the family members and friends who typically accompany medical tourists abroad. One thing that I know from my research that spans over a decade is that many people don't travel on their own. Many people travel with a friend or a family member who will accompany them. That person is going to provide them with emotional support, with hands-on care, such as with wound dressing management, and also help with travel logistics. I want to first talk a little bit about why we should actually care about these individuals. Why is it important that we think about the friends and family members who are accompanying international patients that many people who are attending this forum are actually seeking as their customers or clients? One thing that we know for sure from across the international literature is that informal caregivers actually can directly influence the health of patients. They are providing care. They're untrained individuals who are unpaid for the care work they're performing, but the care that they provide actually influences the health of care recipients. We also know at the same time that those friends and family members who are providing informal care may have their own health negatively impacted by the practice of care. And that may be due to the stress involved in caregiving, sometimes to the physical demands, or even for other reasons. And finally, another important variable is that we know that if you're actually able to adequately support informal caregivers, whether it's through creating informational tools that can assist them or creating other forms of support, it actually improves the health outcomes of patients and also the caregivers. So there's a lot to be said for medical tourism facilities actually turning some attention to this important group who are actually supporting the medical tourism sector in its existence. Finally, another way that we should think about these individuals is that really informal caregivers are actually unprotected or shadow workers in a multi-billion-dollar industry. So again, these are people who are untrained in the healthcare work that they're providing. They're unpaid for the work that they're doing, but without them, medical tourism as we know it really wouldn't exist. And that's why they need to be a focus of conversation, not only in thinking about how this sector is going to exist, if not even thrive, in a post-pandemic era, but in general, how medical tourism should operate, acknowledging that this care work is being undertaken. First, I want to, in this presentation, take you over some of the research that I've been involved in around informal caregivers. And then I'm going to end up with some important talking points about factors we should think about in order to strengthen our support for these informal caregivers in a COVID-19 and post-pandemic era. One of the things that we really have to acknowledge is that friends and family members play a number of vital roles. In introducing this talk, I've already shared some of them, but I want to attune you to a few specific ones that I've picked up on my research, and other people that are involved in academic research on medical tourism have also found in their work. One important role that they undertake is they serve as something that we could call a knowledge broker. So actually, informal caregivers are oftentimes the liaison for information sharing between health workers at home, health workers abroad, as well as health workers and the patient within the medical tourism facility or clinic. This knowledge broker role is incredibly important because actually informal caregivers often play an important role in determining what information is going to get shared with whom and when. This is vital, as you can imagine, for the delivery of quality healthcare. And so it's an important variable that medical tourism facilities run by those who are in attendance at this forum should be considering. Another very important role that these individuals play is the role of a companion. So they're there to provide emotional and physical comfort for the medical tourist, as well as hands-on care. This companion role of simply being present for the medical tourist, again, is an incredibly vital role. Think about the amount of time, effort, and energy we spend on training individuals who are working in the healthcare context. When we think about the friends and family members that are accompanying medical tourists abroad, they haven't been privy to all of that training. And meanwhile, they're trying to exist, if not even thrive, especially within the medical context of the hospital. And then finally, another interesting role that we can think of these individuals as playing is that of a navigator. And with that, what I'm talking about is that these friends and family members are doing things like gathering information around care coordination. They're also doing things like helping with assessing the travel logistics. They're trying to help with making sure that an individual's trip planning is adequate for the return home. So this combination of knowledge broker, companion, and navigator roles are very, very important for those in the medical tourism sector to be aware of. We can't think about these individuals as just sort of blankly providing care. We need to understand the roles that they undertake in order to understand, number one, the value that they add to the medical tourism sector. Number two, the importance of the unpaid labor that they actually provide. And number three, the types of interventions or supports we should be offering in order to support their health and well-being, and ultimately the health of medical tourists. Another interesting way or reason that we should think about these informal caregivers is that sometimes they can actually introduce challenges to the delivery of quality, effective care to medical tourists. So here are a few examples. Sometimes, but not always, they can actually require resources, time, and attention away from the hospital and away from healthcare workers. So these could be things as seemingly insignificant as asking questions about how to get around in the neighborhood or community they're in, other types of navigational supports. But there's other types of attention that they may require, including if they have their own health exacerbation. We need to be aware of the fact that this kind of support is being provided to these individuals and making sure that workers in medical tourism facilities are actually able to direct that time and attention to these individuals. Another thing that we've found in our research is that sometimes these friends and family members can actually disrupt the provision of care. So sometimes friends and family members may be overly protective of the patient. They may challenge decision-making. There's nothing new about this. We know this happens in relation to friends and family members who are playing a role in decision-making around healthcare. In the context of medical tourism, though, this can be amplified because you sometimes even have the patient and the caregiver co-located together, sometimes even sharing the same sort of hospital room and caregiver apartment or unit beside it. So this can amplify that sort of overly protective, key informant decision-making role that we might see actually disrupting care. Another important thing that we should consider as a challenge is that they themselves can actually be exposed to risks to their health and safety. So they might be actually unfamiliar just actually with where to go in the local community that's safe. They may also be unfamiliar with health and safety protocols within the hospital. Things as simple as where are the hand washing stations and how and when they should be washing their hands. We need to make sure that this information is relayed to friends and family members in order to mitigate these potential challenges. Another reason why we should actually turn some attention to these friends and family members is that sometimes they actually require resources that can assist them with coping with the stress that's brought on with caregiving. And again, we should think about caregiving in this particular sort of heightened context of being in an international destination, possibly in an unfamiliar language, maybe in a place that you've never been before with a currency you're unfamiliar with. This creates a very specific potential stressful environment for the delivery of care. So, for example, sometimes informal caregivers will draw on what they've already learned from previous travel. So things like how to know how to undertake travel bookings, knowing where to stay. So these kinds of travel resources are one of the things they can use to assist them with coping with stress. They can also do things like try to draw on existing routines that they have around caregiving and replicate those routines in the destination. So sometimes this even includes informal caregivers or friends and family members making requests if they can actually be involved in meal prep, if they're allowed to prepare the food themselves, or even if they're allowed to access kitchen space within the hospital. This is something that I've certainly heard of in my research. Another thing as well that they're going to do in order to cope with the potential stress or caregiver burden is that they're going to draw on the existing relationship that they actually have with the medical tourist. So the nature of that relationship coming into the medical tourism dynamic is going to very strongly shape the practice of caregiving in this context. Also, we know that informal caregivers can actually do things to protect their health and safety. And this is something that everybody who is attending this forum should be considering. They need to acknowledge that there are actually things that these informal caregivers, these friends and family members can do. And this information needs to be communicated to these individuals, especially prior to their arrival at the destination or at your hospital or clinic where you're working. So one is that they can become an informed consumer. They can ask questions about the hospital, about the procedure, and develop an understanding of what it is that they should expect. They can also do things like assess and avoid exposure to risk. So things as simple as I mentioned already, following the safety protocols in a hospital regarding hand washing. This is just one example of that. Also, it would also extend into getting around in the community, knowing safe transportation routes and safe transportation providers. They can know how to anticipate the medical tourist care needs. So they need to know what's expected. It shouldn't come as a surprise. So if somebody's going to have extensive bandaging or swelling, this should be known in advance, because if they know this in advance, it will assist them with becoming prepared, and it will lessen the stress associated with this care. Another important element that they should do to provide their own, or to protect their own health and safety, is to familiarize themselves with the logistics of the trip. Know what the details are, even do things like have maps of the airports, because actually returning home with somebody following surgery is going to be very different than arriving into a country prior to a surgical intervention. And so these are things that, for example, international patient coordinators and medical tourism facilitators can be and should be talking to informal caregivers about before they accompany a medical tourist abroad. And finally, and perhaps most importantly, is that these individuals can do things to protect their own health. So something as simple as visiting a travel medicine clinic before departure, doing things like making sure that their prescriptions are up to date. These are small examples, and there are other things that can be done as well. But these 5 things must be communicated to informal caregivers prior to them arriving in Korea or any other destination to provide support for a medical tourist. For myself, actually, in my research team, we've created a handout that offers 9 points of advice. I'm happy to share this with anybody that reaches out to me. But what does this mean in terms of the practice of medical tourism during this pandemic and also beyond? We know that people have increased or heightened informational needs. So successful hospitals and clinics are going to anticipate this around informal caregivers and plan accordingly. So what may have been an adequate amount of information to provide for a friend or a family member prior to the pandemic is not going to be the same post-pandemic. People have a greater sense of the kinds of risks associated even with international travel. And so successful hospitals and clinics involved in the medical tourism sector will anticipate this, and they will create informational tools specifically addressing the informal caregivers and not simply the medical tourist. Second to this is that there is heightened awareness of travel-related risk. And so successful hospitals and medical tourism facilitators will actually encourage protective measures. They're going to talk with medical tourists as well as their informal caregivers about how to anticipate these measures and how to navigate them. And then finally, we need to acknowledge that there is great potential for increased caregiver burden in providing informal care to support a medical tourist, certainly during the COVID-19 pandemic and in our post-pandemic life, because of the informational burden, because of people's heightened awareness of the risks of travel. And so successful medical tourism hospitals in Korea and elsewhere are going to actually identify ways to support informal caregivers in order to minimize this burden. Thank you very much for your time.
Now it's time for discussion. First of all, I'd like to ask some questions to each of the speakers. Let me first ask my question to Ilan. Yeah, and you emphasized the importance of giving assurance to the customers. And these days, many experts in this field, they have argued that the hospitals should stay connected with their customers, and even maybe by using SNS or some other online channels. And what would you give us some examples of concrete actions required to stay connected with the customers, and what kinds of messages should be sent to the customers?
Okay, so first of all, in any marketing activity that involves any brand, doesn't matter if it's in medical tourism or any other brand, there is a before, during, and after. So the before is obviously understanding exactly what the consumer's needs and wants are. So you can expect from that consumer something that in return you can address those needs and those questions appropriately when that, I call them consumers, but it's patients, when they actually come to your hospital or your clinic. So you already have an advantage of understanding them and answering their needs while they are in the hospital, while they are under treatment. And again, of course, we realize that treatments could be very, very different. It's very different if you come for a cosmetic procedure or when you go to a cancer surgery. Those are very, very different needs. But the level of communication should be such that in any case, it will be informative so that the patient will know exactly what's going on, and the patient will be comfortable. Making the patient comfortable and make him fully understanding of what is going to happen and what will happen after is, reassuring. And that's, again, it's a human gift that you give to a patient, because we all have been in situations where you are in a hospital and you have the doctor's visit in the morning. So 10 of them are coming around your bed and they don't talk to you. They talk among themselves. And it's like a big secret. What are they talking about? They're talking about me. Well, you need to be part of that conversation because it'll make you comfortable. Obviously, when you finish the treatment, you need to understand exactly what's going to happen then. So these are different levels of conversations that, as a contact point between the establishment, between the brand and the patient, the customer, are very important to remember. And it's also important to remember what to do in every step.
Okay, thank you. Now I have some questions to Claudia. And you talk about the certificate and the standard. And probably you spend a long time to make that standard. And how about, if the hospitals in other countries want to get their certificate, what's the process? I mean, do you send some expert to other countries, or how do you evaluate whether they, follow that guidelines?
Yeah, so when we talk about general accreditation, then this is always accompanied by an on-site visit. So we provide the standards, the organization is preparing for the on-site visit, preparing the evidence and submitting documents, etc. But the final step is always a visit on-site.
Yeah, right. But
to check
how about, on the current, COVID pandemic situation?
Yeah. So for us, we postponed all on-site visits.
I see.
And we are going to start with the on-site visits in Europe this year, end of the year.
I see.
And we have to see when the borders are open and when the risk is reduced that we can do international travels. For the specific COVID-19 certification program, to fill the gap, this is a desktop survey. So these are 60 standards, and these 60 standards, the evidence can be submitted online by photographs, by videos, by guidelines, by checklists, because this is really specific how to deal with the COVID-19 challenges. So this is a different story. But general accreditation, we decided internally that we will postpone the on-site visits because they are very important for us to see what's going on site.
I see. And my second question is, the Valorie also talk about the caregiver issues. And how about your standard? The standard also includes some, activities on the preventive measures on the family members, caregivers. How about your standard?
Yeah, definitely. So the family members or caregivers are included when it comes to the service provision or the definition of the service provision of the healthcare provider. So to influence, to give feedback then they are included in the processing, especially for the medical tourism or the international patient care cycle. So we are not only talking about the patient standards, say, do you also offer accommodation for the caregivers, the relatives? What about transportation services? So the non-clinical services Ilan also mentioned beforehand, which are so important nowadays, they are also included in our standards.
I see. Thank you. And now I have a question to Valerie, and you talk about the caregiver issues. And my question is, how about the hospitals in Canada? And do you show us some examples of how the hospitals in Canada provide services to the caregivers?
So most hospitals in Canada, when they would be providing support for informal caregivers, would be doing so for caregivers who are caring for local or Canadian patients, as opposed to international patients. There are all types of outreach that happens within Canada. The work that informal caregivers provide is actually recognized as an international or as a national or domestic priority for the health system. So there are all kinds of supports. These include, for example, including informal caregivers as part of the care team. So making sure that interaction between healthcare workers and caregivers is actually supported by healthcare administrators and by actually how healthcare providers are trained. There are lots of support groups for informal caregivers. There are also informational resources, including navigational aids, pamphlets, all other types of things that are able to support informal caregivers. And then outside of the sort of shorter term period of care that we might be thinking about, for example, for one surgical intervention, for people who are involved in providing care for much longer terms, we actually have government support programs that enable people to do things like have a protected leave from work in order to provide care for a friend or a family member who has a defined need.
I see. Okay, thank you. And how about, whoa. How about, do you have any other questions with each other? Okay, thank you so much.
Thank you for inviting us, and good to see all of you. Take care. Bye.
Bye.
Bye.